Welcome to another episode of the Chun Show. On today's episode, I have an honor of having Dr. Hany Takla. I want to say he's a young surgeon. If you saw him, you said, gee, the guy looks like in his 20s. I just learned today his true age, 40. And I invited him because I want to hear his story all the way from Egypt to this country. And I'm going to call him right now because I want to hear. I've dedicated this entire episode to Dr. Hany Takla. So let's welcome him.
Hello.
How are you?
Good. How are you? Can you hear me?
Yes, I just want to see you. There you go. Excellent. How are you?
Good. How are you?
Good. I was just saying, you look like you're in your 20s. I had no idea that you were 40.
I am.
So,
Believe it or not.
I know, right?
Yeah.
So, Dr. Takla and I, we work together at Winchester Hospital. But I want to really hear about his past 12 years he has spent in this country. So, Doctor, so you're born in Egypt, Cairo.
Yes. hmm
Tell us a little bit about your childhood.
So I lived. I was born and raised in Cairo. It's kind of, the biggest city in Egypt. It's very dense population. Something like New York, in terms of, traffic and that sort of stuff. So I was raised. Both of my parents were physicians, and I was raised sort of, physicians over there is pretty much similar to here, I guess, like middle class. And I was born, raised there, and throughout school and such. Both my parents were physicians, and I got really interested in medical school, and I was involved a lot in church when I was a kid and such and things like that. And had a lot of friends that we used to do a lot of sports and things like that for the church team, which was nice. And then I was interested in medical school, and my dad, who was a urologist, actually, I remember till this day that he advised me against going to medical school because
Smart.
it's
You should have listened to your father.
exactly. So it was, he said it was long. You're going to work long hours. You're never going to be, paid enough. And you'll just, work all of your adult life, and you'll be studying half of your life. But I was stubborn, and I said, no, this is what I like. This is what I want to do. And I went through school and high school, and then over there you go to medical school out of high school.
At age
So
of
very smart.
17.
Correct, yeah. So 1997 is where I applied for medical school, and you have to be sort of like on the top 10% of your class almost in high school so that you can apply for medical school, and then you apply for, different schools. And Cairo University is the best school that was there back then. And that's where I got into medical school. It was 1997.
Well, you are being humble because Cairo University is like Harvard or Yale. It's
Yeah,
one of the best universities in the world. Um,
correct.
so, interestingly, you mentioned church?
Mhm.
Most Egyptians are Muslims, right?
Correct, yeah. Yeah, that's the majority.
And that means, were you part of that Coptic Christianity?
Correct, yeah. My family is Coptic Christian, yes.
Okay.
So it's like an Orthodox faith, so it's very similar to the Greek and Russian like Orthodox faith.
And that Coptic Christianity is mainly in North Africa, I think, right?
Correct, yeah. And in Egypt, like the majority of Christians are Orthodox, but there are other others that like Protestant and Catholics. So there's a variety of Christians back there too.
Now, sounds like Egyptian education is similar to Korean in that you apply to med school right out of high school, but your language skill, you speak English, French, Arabic, all fluently. I mean, one would
Yeah,
never know you're from Egypt.
yeah, well, I mean, in school, so in school, you have to learn, in addition to Arabic, you have to learn two languages,
Mm.
and even like government schools. So you have to you have to learn, and you choose. Like most of the people learn English, and they choose another language, either German or French. So that's for all schools there that you have to learn two additional languages other than Arabic. So mine were English and French. I mean, I guess my accent, I used to watch a lot of movies, like American movies, and that's
Yeah.
how I got, yeah,
You know, one of my mentors at Boston City Hospital, Dr. Um, Abdul Mohammed Hamid, Egyptian,
yeah,
and I know he spoke French, but you could tell he was from Egypt because of
yeah.
his accent. But with you, one would never tell. So after that, you went to do residency in general surgery and plastic surgery for 4 years, and then you
Yeah.
got drafted into military.
Yeah, it's kind of you have to do it. There's no option. They have certain rules. We have certain rules. Like if you have other members of your family that can work, like a
Mm-hmm.
brother that can work and support the family, so you have to go to the military. So it's like compulsory. If you have a sister, then you don't have to because you're the only one after your father that could work and support the family. So yeah, I went. Both me and my brother served in the military.
So I mean, in South Korea, it's mandatory because South Korea always ready to fight North Koreans. But in
Yeah.
Egypt, who are you going to fight?
Well, I mean, I guess I don't know. I mean, it's been like that since the war with Israel. I think it's been like that. The military has been set up
Mm,
like that for years after the revolution in 1950s. And I think it's been like that, that these are basically the rules, and they're the rules up till now.
mm.
It's all, mandatory. There's no option unless you are the only supporter of your family, if you're the only child, or if you only have a sister that can't work, then you have to go to the military.
So just sticking with that for a little bit, it was a year. Is it because you're a physician?
Yeah, so if you're a physician, but you're also work at the university. So after I graduate from residency, they they basically offer you a job at the university to be a faculty at the university. So if that happens, then you get drafted as a soldier. So
Mm-hmm.
that's only 1 year. If you don't, then you have to spend 3 years as like an officer.
And then after that, you did a year of private practice and then decided it's time to come to America.
Correct. Yeah, that's true. I got frustrated.
Yeah,
Yeah,
I'm sure.
yeah.
So, coming to United States for you, was it through, did you apply for work visa? Or how did
No,
you get to United
so I
States?
applied. It's through residency. So
Mm,
what happened is that after, I got frustrated a little bit. I wanted to, go learn something new, be, I guess, in a better system. That's what I thought. And so I applied for residency, and then through residency, you get on it's called an exchange visitor visa, and then that's how you basically get there. You get like a visa for residency.
and that's a very important point for American residency training because it turns out that I think maybe a quarter or third of residency spots are taken by foreign American graduates.
Correct.
It's a
Yeah.
big number. And here is where it gets really tricky for people don't realize. First of all, Haney, you went to one of the top universities in the world, and you did your residency training already. So you could have been in, I mean, you were in private practice, but even with that, you had to come to this country and repeat the entire residency training.
Correct. Yeah, I mean, I guess these like medical systems don't talk to each other. So,
Mm-hmm.
I mean, they recognize that you, like here in the US, the system recognizes that you went through medical school, but they don't recognize your training.
Mm.
I guess because it's a different type of training. I'm not sure, but they recognize that you went to medical school and you have to go through the USMLE exams, which gives you the license to practice medicine. But in order to subspecialize, like in surgery or medicine or psychiatry and whatnot, then they don't recognize the training in other countries most of the time. I know that there are certain exceptions, But most of the time they don't. Sometimes they'll count for, those 3 years or 4 years as one year, and then you'd start as a second year or third year. But it's very rare. It's very hard.
Good friend of mine, his father was chair of orthopedic department at Korea University, again top university, and then he came here in his 40s. He had to do it all over again. So it's, but that training, how would you compare your training here versus one in Egypt?
It's very, very different. I think, the training in Cairo is very, there's a lot of autonomy.
Mm-hmm.
And you basically learn a lot from a high volume of seeing patients and doing surgeries, and you have a lot of autonomy. So as a chief resident there, for example, in surgery, which is much different than here, you have your own basically list of patients to see. So you see patients in the office, you book them for surgery, you actually do the surgery on your own.
Hmm.
The attendings there are there to support you basically if you need help, or if you have a tough case that you want to ask them to help you, and they're available. But as a chief resident, you basically run your own practice, even at a university hospital. That being said, it's kind of, it's only at university hospitals. So if you're completely private in Cairo, you can't really do that as a resident. I mean, you have to be, an attending or graduated from residency to be able to do all of that on your own. So teaching hospitals basically allow that.
And you had mentioned that it was frustrating, right? Which is why you decided to come to the United States. Was it because
The
of the
the
just the?
practice was yeah, the practice was frustrating because of a variety of reasons. One is the economy
Mm-hmm.
and the finances of it. It just does not, like, physicians in Cairo just do not get paid well
Mm.
for the amount of work that they do. They do not get compensated well, and it's very, very hard to establish a practice when you're a young physician working from the ground up. It's just very, very hard. It's much less appreciated as a profession, as
Mm.
more like much less than what it should be. And then the last thing is like politics and the environment over there, and being a minority there is not super easy either to find jobs. And one of the things I wanted to do, for example, is wanted to do plastic surgery, and I was told at one point that because of certain things that I can't pursue certain specialties and things like that. So,
Minority because of your religion?
yeah.
Okay. And at that time, the country was still under the control of President Mubarak.
Correct.
So, and then I think he got ousted like 2011. So
Correct.
now you have a newer president since 2014. Are things any different?
I don't think so. I
No.
think it's all the same. I think the transition that happened to the Muslim Brotherhood was just sort of in the middle of like turmoil. And then now it's back to basically military rules, same exact rules as it was before, people that want to persist in power and, don't give, more room for people to, speak freely. And, so it's the same. I think it's exactly the same now.
So suffice to say, had you stayed in Egypt, then you would not be that robotic expert that you are now, right?
I don't think
True?
so. I don't think so.
Right?
No, I would have been a completely different type of surgeon, or maybe even like stop practice or something. I don't know.
So you came to
Definitely
this
a big opportunity for me.
to this country in 2009.
Correct. Yeah.
So in 2009 is when the Da Vinci, I think, got FDA approval, and that's when it became a into clinical practice. So since
Correct.
then, you did your residency at University of Washington, University of Mass, and then you did your fellowship in University of Arizona. Now you've settled at Winchester Hospital, where you are the
Yes.
head of robotic program.
Correct.
You know, and I think because I mean I have asked you for assistance a few times, and you were the go-to guy. And when I think about the healthcare, I worry in that at least in, and I think this is true all across, but there's a shortage of qualified surgeons, shortage of qualified doctors all aboard. But surgery,
Yeah.
and I'm going to ask you about this because for OBGYN, there is a huge shortage, and we are in Greater Boston, and I cannot think of very many qualified GYN surgeons around me. What is it like in general surgery?
I think it's the same. I feel the same, and I attribute that. I think the training, training here is just very, very different, and it actually changed. I think even since I was in residency, I think just the residents graduate from their surgical residencies now not comfortable doing surgeries on their own, and we're trying to change that. I mean, I'm trying to work with the teaching hospital that we're affiliated with to try and get that better for those guys because they graduate not comfortable doing surgery. Like even now, I tell some of my friends is like if I needed a hernia surgery, I'm just gonna I know who the person to go to because it's just there is shortage because there's not a lot of expertise in terms of training. Like people graduate from residency not comfortable doing surgeries that they're supposed to. And it has a lot of reasons, work hours restrictions, number of cases, volume of cases, a lot of the, what we call them bread and butter general surgery cases, which are, the very simple, easy, straightforward surgeries that we do, don't go anymore to teaching hospitals. They go to smaller community hospitals like ours or other hospitals. And so the residents don't see those as much. That's why you'll see a lot of the teaching hospitals in the United States diverted a lot of their rotations to smaller community hospitals. And they want that because they don't want their graduates to graduate not knowing how to do a hernia surgery, which is the most basic surgery in general surgery.
Well, first of all, I'm told that in another 10 years, we'll need at least 100,000 more um, doctors because there'll be a shortage.
Correct.
They're not going to increase the number of medical school. So, and they're not going to increase the number of medical school student enrollment. I think it all has to do with money. So, only way for us to, and this sounds very selfish, but only way for us to increase and meet that number is inviting foreign medical graduates, which is the other side is that, gee, we're taking doctors away from countries where they are needed. But in this country, you know, the huge shortage, and I don't know what immediate and long-term solutions are. Uh, you are busy because you are a very competent, qualified robotic surgeon, so you have tons of cases that you get to do. But I feel like we need a few of Dr. Takla north of Boston because I know that I go north of Boston from Winchester Hospital, right?
Mhm.
There aren't very many other competent robotic surgeons. This is out of what, 4 or 5 hospitals, which serve, I think, if I think about those 4 hospitals, I'm thinking about between those maybe 7 to 8,000 or 9,000 newborns combined. That's a sizable community. Yet we don't really have a lot of Teklas to meet general surgical demands. So the question becomes, what do we do in 10 years? I mean, how fast can you turn these doctors out?
Well, I mean, a lot of it also has to do with, how people perceive, being a physician, what's the motivation to go to medical school? What's the motivation to go into surgical training? We have a lot of, residents that rotate through that get burned out because they, see people, work hours and that sort of thing. So it's not I mean, it's a tough thing. It's a tough solution. And I mean, you want basically to make the, medicine attractive profession for people to work at and also make it basically a nice profession to be at, not I mean like maybe like playing football, I guess,
Yeah.
to make it attractive for people to join, and that's not easy because of funding and other things. But one of the other major issues I think in the healthcare system here is a lot of the money that goes in the healthcare system goes to either medical device companies or insurance companies that are like higher level management positions and things like that. And that's a lot of the money in healthcare goes there. It used to be a research and it used to be training, but it's not anymore now. So it's more of like running a business, but how to make this business more attractive for people to join. That's why foreign medical graduates want to come here because for them it's a better resources, better economy. They get appreciated a little bit more than their countries, and they get paid much more than their countries. And so it's attractive for them, but for local, like, for Americans, it's kind of, you work a lot, you have to get paid, okay, but, still for the work hours and what you have to do, maybe not so attractive. And you have to study for a long time too.
The reality is, when it comes to surgical specialty, it's the volume, it's the experience. And you have to do X number of cases. And I feel like sometimes people choose wrong. I mean, if I see some of the GYN surgeons, I think they pick the wrong specialty because they can't operate and they don't do enough.
Yeah.
And, first of all, you have to be competent, get good enough cases, and do enough. And you have to do that over and over and over. And I see that, and I don't see that changing in GYN. And hopefully that's not the case in general surgery. But anything complicated for GYN cases, like at where I am right now, non-cancerous case, and it's a benign, complicated case, if I'm in a deep doo-doo, then I don't have anyone to call.
You can
Unless
call
it's,
me.
that's right. If it's general surgical case, call you. If it's not, then I would have to send him outside. And it's not a very comforting thought that if you get into deep doo-doo, that there really isn't anybody to call. Have you are there any difficult times you've experienced while you're going through training as a foreign medical graduate, the first 4 or 5 years?
Yeah, I mean, definitely. I mean, it's hard at the begin. It was hard for me at the beginning. There are different aspects of it. I think, in Cairo, I mean, we train and we go to medical school. Yeah, we, learn in English and everything like that. But, dealing with patients day to day and dealing with, each other and such is in Arabic. So one of the first challenges here is basically I have to translate what's happening in your mind first before you
Mm.
speak it. So, I have to basically process what's that person is telling me in my mind, change it from English to Arabic in my mind and speak it from Arabic to English. So that was a little bit of a challenge at the beginning, like, maybe the first, few months or so. And the second thing is the healthcare system itself. It's completely different. I mean, the way we think about, managing patients and, terms and like just daily day-to-day things that a lot of it has to do also with dealing with patients in terms of their issues. So, in Cairo, as a physician, you're basically perceived as the physician. So whatever you tell the patient or you recommend is like, you know, is what they probably do. But here you have to give, people options and, discuss how these, like, what are the pros and cons of each option and why you think it's good for them, why do you think it's bad for them. And a lot of the harder questions I'll get from patients actually here that didn't used to be hard when I was in Cairo is, what would you do if I were your, mom or
Mm.
your grandmother? And I would tell them honestly. In Egypt, that's what we basically tell them right off the bat. So we don't
Mm-hmm.
tell them, oh, there's option A, option B. If you're my grandmother, I would do A or B. You tell them, I think you should do this. And they perceive it as that. In Egypt, they don't ask you, they don't want you to give them a lot of options. They want you to
Just
say
just
your
do it.
opinion as a physician.
So does that mean that medical legal environment is very different in Egypt compared to here?
It used to be very different. I think now it's different than when I left. I mean, it's been 10 years, but I think now it's very close to here, very similar to here. But yeah, the medical legal environment is very different. Basically, what I can tell you is, whatever happens to the patients there that we treated, they were just grateful, regardless of what
Mm.
it is, regardless of the outcome, regardless of what happened. Even if there was an error and, disclose it to them, they're still grateful. It's very different.
I think in this country, the key is really establish a relationship. And I think because I do obstetrics, we have an opportunity to see patients over 12, 16, 20 times over the course of 9 months. Whereas with you, people usually come to you because there's a problem. And you being new, some of the patients probably have had visits with other general surgeons already, and they're coming to you as second opinion or third opinion. So patients may be maybe in a negative place to begin with, you know. But here, um, can you imagine there was a time in my career where my malpractice was $114,000 just for me. That's almost
Oh,
$10,000 a month.
mm,
Now it's, I mean, now I say it's cheap. It's about half of that, five
mm.
thousand a month. It's like 5,000 a month. Can you imagine if there's a mortgage? It's a nice house, but
Yeah.
that's what I need to spend. So somehow the environment has changed. For me personally, it's my relationship with my patients where I think because it's positive, I never really worry about malpractice. And I think that's because I have long-term relationship with them. Maybe less so with the GYN patients.
Yeah, no, I agree. I think it's important to establish that, be honest with the patients and tell them exactly. I mean, some of the patients I tell them, your risk is this and that, and they're like, yeah, I don't want to hear about this. Like, no, I have to tell you everything. And, I think being honest with them about even, errors, complications, whatever it is the thing that established that relationship. And I've had a lot of patients here that, were grateful as again, I mean, regardless of what the outcome was and because we feel, I mean, I think as surgeons in general, we feel that obligation and always feel bad if something happened to our patients, even if it's within the known realm of complications or whatever it is, or the risks from the surgery. We still feel that as a human being, you're responsible. You're doing surgery on someone
Mm-hmm.
that asked you for help, and they had an issue, whether it's because of the surgery itself or because of their disease process or whatever it is, but you still feel that they asked you for help and you're trying to do what you can, and if something happened to them, then you're responsible for it somehow.
So right now, Winchester, aside from being a busy private practitioner, you got your hands in educating next generation of surgeons.
Correct.
So
Trying.
trying. So where do you see yourself in 10 years, Haney? Just where you are right now? Will you be getting into more administrative, which is, I think, a lot of younger generation of physicians are trying to get into administration just because you feel like you have some say other than just being soldiers, you know?
Yeah. No, I mean, I enjoy surgery and I enjoy doing surgery, so I don't think I want to give that up, for administrative stuff. I mean, things might change and, with whatever age and things like that, but I think, definitely, dedicating things to like more complex cases, like revisions in bariatric surgery, for example. And I've had patients, even from out of state come in, like same exact thing as you. They seek you out from out of state because
Mm-hmm.
they know about you and such. And also education. We have residents that rotate. We're trying to figure out if we can have the fellow rotate with us, have a robotics fellowship. These are the things that I would see myself doing. More complex stuff, helping more people, trying to educate more residents, fellows, things like that.
Let's talk about bariatric surgery.
Okay.
Booming business, right? Your
Mhm.
volume is increasing.
Yeah, I mean, I think it's a big problem. And I mean, a lot of the people that come into the office, I tell them, there's a lot of things in bariatric surgery. I mean, it's not, people think about it as it's an operation that you do surgery. There's nothing wrong with you. Why are you doing surgery that's, elective, or, you're just doing it to lose weight? You could lose weight on your own. And it's hard. I mean, I see patients day in, day out in the office that are struggling with just diet and medications. They work, but they don't work very well. And then, there's a lot of experience with bariatric surgery over the years that it is the go-to method to be able to lose weight. And if someone's committed to it, they really
Mm-hmm.
do very well. And I've had patients in my office, I saw them, did surgery for them, and come back and challenge me to do like a half marathon or whatever. And they're happier because not only because of losing weight, but also, they were short of breath, they had high diabetes, hypertension. Most of these things go away when they lose weight. So it's definitely something that a lot of people are seeking because it's important for their health. It's not just something that they want to look nice, and do it because they want to look nice.
So, what percentage of your patients would you say have um, you would consider successful outcome?
It's about
Half, a
70%. So it's 70,
70%.
80% is the known number, and that's what I see in my practice. So 70 to 80% of people will lose weight, they'll keep the weight off.
Mm-hmm.
30% will regain some weight. We know a lot, there's a lot of things that came out in the literature that also showed that they don't regain their medical issues. So if someone had diabetes and had a gastric bypass, they regain some weight.
Mm-hmm.
A lot of times they don't get the diabetes back. but I think it's about 70%. So these patients, when someone's committed to this journey, they do really well. If they put their mind and heart into it, they do very well.
So, particularly in Boston, there are many bariatric surgeons.
Yep.
What makes Dr. Takla's program different, unique, that they should consider you versus going to Brigham or Mass General or even Lower General?
Well, we have a lot of things extra at Winchester. It's a nice place, and it's community hospital. Patients like to be in it. They don't like to go downtown. One thing that I personally offer more at Winchester is robotics, and a lot
Hmm.
of the things that happen with robotics are people don't understand. I mean, a lot of the surgeons, they get criticism from bigger Boston hospitals is that, oh, you're using a tool, and you're using a fancy sewing machine. That's not true. There's a lot of advantages for it in terms of postoperative pain. All of these patients, they go home the next day. They spend in the hospital 12 hours. They go home the next day. They're eating, drinking, having, extra strength Tylenol, controlling their pain because of, there's not much torque on the muscles. We see better. It's a three-dimensional view, as you know. There's a lot of the advantages also about the blood flow. There's a technology in robotics, as you know, called Firefly, where you'd inject, IV material. You can see the blood flow to the tissue. That's very important for bariatric surgery because a lot of the big issues that happen with bariatric surgery in terms of leaks and things like that are related to inadequate blood flow. And if you can see it, then you can try to prevent it intraoperatively so that people don't have these issues. So we have that. I mean, we have that at Winchester. We have robotics. We have the expertise, among myself and other surgeons that we could do revisional surgery, meaning people that have had bariatric surgery and have had a complication from it before, or something, they didn't lose enough weight. There are some options to help with that. And then robotic surgery facilitates that. And then I've had a lot of patients that have had open, bariatric surgery before, and we've been able to revise it with the robot, and they did very well.
I have also always found those critics of robotic surgery is that they can't do it. I
Yeah.
mean, because I think you'll agree, if someone few years after residency, if they were not trained, it takes 2, 3 years of commitment before feeling comfortable. And most private practitioners don't have those 2, 3 years. So there's no comparison. I mean, once you know how to fly, why would you drive to Florida? You want to fly to Florida. And these people always say, oh, I can do it with straight stick just the same. There's no way. You cannot. And I mean, I hear the criticism all the time.
Yeah.
What's the weight of the patient that weigh the most on bariatric surgery for you?
Sorry, what's that? Can
The,
you repeat
the,
that
the
again?
heaviest patient you operated on.
I think I mean I have a handful of patients that are above 400 pounds. Our weight limit at the hospital is 450, but I think the
Mm,
heaviest person probably was in my fellowship. It had a body mass index of 80. I think she was like probably 480 pounds.
mm.
In practice, probably 390 or 400 pounds so far, but I know that I have a handful of patients coming up that are above 400 pounds.
I mean, this is at like another level. These are not only, on one hand, very necessary surgery, but it's not for average Joe in terms of, it's not for average surgeon because these patients poses many potential medical complications. But if you are at the level where these just become routine, I think that tells you where you have reached professionally. Um, and I
And I
and
think it takes, I mean, it's kind of like something that you challenge yourself. So I mean, I see, like when I first started my first year, sometimes I would shy away from, I remember, a patient in particular that came in to see me my first year because the patient got turned down from all of the, almost all of the Boston hospitals for revisional surgery. And I said, this is my first year of practice. I know how to do revisional surgery and I trained in my fellowship, but maybe I'm not the best person because you'll be basically my first revisional patient.
mm,
And, you know, months come by and then the patient comes back and said, no, you're the one that's going to do my surgery because there's no one else, that everybody turned me down. So you take on the challenge and say, okay, well, I'll do my first revisional surgery for you because you came into me and you asked me for help. I'm going to try to help you. And you do it and you take the next challenge on and the next challenge on. And that's how you get into, doing, heavier patients and more complex patients. And that's my goal sort of moving forward is, try to do things that are more complex, things that are more challenging. Because if you don't have challenges in surgery every day, it becomes
Right.
boring. So if you go in, every day doing your, 4 or 5 inguinal hernias that are straightforward, easy, not recurrent, and then you go home, then after 5, 10 years, it's like, okay, what am I doing now? There's nothing different about it.
So sounds like maybe you could turn Winchester into one of those centers of excellence for robotic surgery, right?
Yeah, I mean, we're trying. I mean, I don't know if you know, but in terms of the numbers of robotic procedures, all combined, general surgery, you guys, GYN, thoracic, we're actually the second busiest program in Massachusetts in terms of numbers. So that's pretty
Wow.
good.
That's
Yeah,
even compared to teaching hospitals, huh?
correct.
Wow, that's amazing. So, would you like to see more young Taklas from Egypt coming to the United States, following your footsteps?
I would love to. I mean, I know that there's a lot of talent, and there's a
Mm-hmm.
lot of people that are willing to work hard. I know a lot of trainees that contact me from there saying, is there an opportunity? What can you help us somehow? So yeah, I mean, I think there's a lot of people everywhere. I think even here, some of the medical students that rotate through, whether their backgrounds are American or foreign or whatever it is, and they're willing to take a challenge and work hard. And I think those people are supposed to be the people on the front lines, because you go in after taking call for whatever overnight, and then you have to that's my call. I take call and then operate, and then maybe the next day I have a full day. So you need someone that's really invested and wants to do that, or has it in them to take that challenge on. So yeah, I mean, I would love to see more people. I would love to see more surgeons that would help me when I get old and need surgery.
Well, one of the things we just started doing was to promote these episodes in your country. So we're gonna promote this episode in Egypt. See how many calls you get. But
Okay.
but um, and I think that's one of the reasons I decided to do this program is because I know how tough things are for everyone. But even though for me I have lived here for almost half century, I think my little world is such that I'm very grateful. Busy practice. I work in a very nice hospital. Lovely patients. Very um, supportive and collegial colleagues in different departments. It's a nice environment where I think I can work for a few more years. And I tell my kids, had I stayed in Korea, being where I come from, I would have never been able to go to med school because of finance. Here, it's a very different story. And during this time of COVID-19, good number of healthcare providers across the nation are immigrants. We make up, I mean, even in Winchester Hospital, if you look around, there are tons of us in ICU, general surgery, maybe not so much in OB/GYN department, but they're everywhere. And
Yeah.
where would the hospital be without us? You know? Um, and it's very positive environment. It's very, and I say no one appreciates America as much as immigrants. So in 10 years, I see you'll probably be getting additional academic appointments, and you would have turned Winchester into a very nice center for robotic training and whatnot. Any other personal goals you have for yourself outside of medicine?
Um, I mean, I would want to have, fun with the family. I would want to have, time off and to go back and relax in Egypt, for example, have, some time with the family back there. My brother still lives back there, and, my wife lives here, and my parents live here, but maybe, have some time with the, family and things like that.
Overall, it sounds like you haven't had any negative interaction with anyone for the past decade or so as an immigrant. It's been pretty smooth
No,
sail.
not necessarily, no.
Is there a
Nothing
big
negative, no.
Is there a big collection of Egyptians in Boston, relatively new
There
immigrants?
is, yeah, there is,
Yeah.
yeah, there's relatively big, big number, yeah. I
Is
don't
there
know the
a,
exact number, but there are.
do you go to an Egyptian church?
I do, yeah.
Yeah. Where is that?
So there's a couple there. There's actually eight, I think eight total Orthodox churches, and the one that I go to is a Natick. But there's a lot of them. I think there are eight total in Massachusetts.
Um, I think that you are a great example for many young foreign medical graduates. I will say passing all those exams is not an easy task. I know more than one who did not pass. I mean, I used to work with a physician who could not pass those tests. So when I was working as a waiter, he was one of my fellow waiters because he couldn't pass the exam. So you've gone through monumental tasks. You are doing so well. Very proud of you as a fellow immigrant. And you know, this is just sharing positive stories is what this episode is all about. So I appreciate your time. In
Yeah, thank
your,
you very much for having me, Bill. I appreciate it.
of course, one of the things we like to finish the program is asking you to say something positive in your own native language.
Oh wow, that
I
caught me by surprise.
forgot to tell you that
Um,
one.
so that's going to be in Arabic, I guess.
Of course.
Um, I would say لو أي آم، أي تحديات في الحياة ممكن الواحد يعديها. دايما بتبقى صعبة في الأول والتفكير فيها مش سهل. بس لو دايما بتفكر لقدام بتفكر هتعمل ايه خطوة بخطوة، مش لازم تفكر كمان 10 سنين هتعمل ايه، كمان 20 سنة هتعمل ايه. لو فكرت بكرة هعمل ايه، بعده هعمل ايه، خطوة بخطوة تقدر تعدي. أنا عمري ما كنت أتخيل إن أنا أوصل زي ما أنا دلوقتي، بس ده حصل. فكل اللي أنا عملته ما عملتش حاجة مختلفة، ما عملتش حاجة رهيبة. فكرت بس خطوة بخطوة، أنا الخطوة الجاية عايز أعمل كذا، الخطوة اللي بعدها عايز أعمل كذا. So that's it. I can
Wow,
tell you translation later.
that's the longest version that we've had. Usually it's like 5 seconds. Yours is like a book. Well, I'll have to ask you what that means. Thank you so much, and we'll be inviting you back for another episode. Thank you.
Okay.
Have a good night.
Thank you. Thank you too.
So, Haney was very humble. Like I said, University of Cairo is one of the top universities in the world. To get into that med school, you would have to be like top 1%. And just imagine having gone to med school, having done your residency, ready to practice in your private office, decides to come to the United States. He had to go through the whole training all over again. And the fact that he's head of a robotic program in Winchester Hospital, the program that ranks only number 2 in terms of volume for the entire state of Massachusetts, that says a lot. We're talking about there's Brigham, Mass General, BI, Boston Medical Center, Tufts. They're all the hospitals with the University of Mass. That means he's operating. And robotic surgery is one of those things where quantity matters. It's interesting. Many of us who use robotics system, Da Vinci, all of us know exactly how many cases we are doing and we have done. It's one of those things we keep a track. So, another proud immigrant American I got to spend time with, and I got to learn something about Hany that I had not known. He's an amazing surgeon, and it is true that I have sought after his expertise when I was operating a few times. Thank you so much. I guess we will know in a couple of days where things stand after the election is over. So I hope all of you get to vote. Have a good night.